Washington Governor Jay Inslee is asking the state of Idaho to do a better job handling COVID-19. Kootenai Health, North Idaho's biggest hospital, is at 97% capacity and now has to send patients over to Washington and Oregon. And Maher, how is that impacting Spokane?
Yeah, the impact this has on Spokane is what Governor Inslee is most worried about. Now, you can't blame just North Idaho for the rise in cases here locally, but Inslee was not pleased to see Kootenai County lift its mask mandate in the middle of a COVID surge.
Kootenai County is removing a mask mandate while they're shipping us their patients? I'm concerned about that.
Governor Inslee is growing tired of Washington's neighbor not putting in place proper COVID restrictions. A model from the University of Washington shows how many people are masking up in public across the U.S. Right now, about 75 to 85% of people wear one in Washington, compared to just 40 to 50% in Idaho.
We will continue to help them in our hospitals. Their losses are ours, but we sure could use some help.
Despite that surge in North Idaho, Inslee says he is not considering a quarantine for those who cross the border.
Well, the interchange between the two states on a daily basis is so profound, it'd be very difficult for people in so many different ways.
The State Department of Health is also asking people in Washington to do better. They say if 95% of people mask up, then 1,000 local lives could be saved by February. Inslee says that and distancing are the only ways to contain COVID-19 right now.
Some folks think that we can just take vulnerable people and put them in a bottle and put a cork on the top of it and protect them until a vaccine shows up. That just isn't possible.
And Washington is preparing for that vaccine. Today, the state joined a pact with California, Oregon, Nevada, and Colorado. Once the FDA approves a COVID vaccine, those states will have their own team to make sure it's safe and effective.
Our state is going to be ready to distribute it in a way that is as equitable and efficient and safely as humanly possible.
Now, there are 3 vaccines in phase 3 trials right now, and that means we could see a vaccine go out to some people as early as December. Live in studio tonight, I'm Maher Kawash for News Now.